Good evening, namaskar, and a warm welcome to another exciting knowledge and learning session by the Fortis Group of Hospitals. I'm Dr. Manisha Singh. I'm Senior Consultant Gynaecologist and Head of Reproductive Medicine and Surgery at the Fortis Hospital, Bangalore. Today, we are going to talk about preserving fertility. So I'm going to start sharing my presentation. And so I hope you can see my screen. So yes, that's me, Dr. Manisha Singh. I head infertility and assisted reproduction at the Fortis Hospital, Bangalore. And we're going to talk about preserving fertility. Now, why are we going to talk about it? In today's day and age, we all like security. We like to have contingency plans. We work hard day in and day out to ensure a better tomorrow and future. So, similarly, in this very busy world, we must think about ensuring that we preserve our fertility for the time when we deem it appropriate to procreate and have babies. So, today I'm just going to touch upon freezing of eggs and sperm freezing. As we all know, assisted conception in the form of test tube baby, IVF, ICSI, intrauterine insemination has given a new ray of hope to a lot of couples across the world. And the first IVF or test tube baby was born in 1978 on the 25th of July, Louise Brown. And since then, we have more than 9 million babies across the world who have been born via assisted conception. And the numbers are growing. Now, when we go down the route of IVF, we must stimulate the ovaries to allow for the growth of more than one egg. But we need only one egg and one sperm to create an embryo that will hopefully implant and result in the formation of a baby. So, what do we do with the remaining eggs that we obtain? Now, those eggs can be utilized for creation of more embryos, and these embryos can be frozen for use at later date. So, what is cryopreservation or freezing? Essentially, cooling or freezing of gametes and storing them for prolonged periods of time is called cryopreservation. Now, this is not the same as picking up your fresh veggies and putting them in the freezer and using them when you think it's appropriate. We need to use the appropriate cryoprotective agents so that these delicate little cells do not get damaged from prolonged freezing. And there is no ice crystal formation within them, as we see with all the food items that we store in the freezer. We have two methods of freezing, and I will not delve very deep into the technology of it. But there are two ways. One is the slow freeze technique, and one is the vitrification or the ultra-fast technique, which is what we use currently. So let's look at what we have done so far in terms of freezing or cryopreservation. We successfully cryopreserved embryos because they are more solid structures. when it comes to freezing. And the test of freezing is the outcome when we defrost or thaw out these cells. And the embryos technically are more robust, and we successfully cryopreserved embryos in the early 1980s. And the first freeze thaw embryo baby, Zoe Leyland, was born in 1984. Interestingly, even before embryos were frozen in the 1950s, the scientists have successfully frozen fowl sperm, and this was used in the farming technology, later implemented into human fertility treatment cycles, and frozen thawed human sperm was used for IUI to give us successful pregnancies. So this technology was then extrapolated to the egg or the oocyte. And through the 1980s, scientists went one step further to try and see if they could do the same with the oocyte. And the very first freeze thaw oocyte pregnancy was reported by Chen and team in 1986. Of course, in those days, the slow freezing technique was used, and today, as I mentioned earlier, we have moved to ultrafast freezing of the oocyte. It has taken a very long time for this experimental trial of oocyte freezing and thawing to come into clinical practice. And there are a few reasons for the same. The egg is a very delicate structure. It's a microscopic 120 micron structure. And freezing this delicate little cell can induce intracellular ice crystal formation. And this can damage the microtubules and the filaments within the egg that can subsequently have an impact on the chromosomal segregation. The other problem that would come up with freezing of the egg was that in slow freezing, the outer shell or the zona pellucida got very, very hardened. But of course, that has now been circumvented because we now do ICSI or intracytoplasmic sperm injection. Therefore, the sperm does not need to work hard to penetrate through the shell of the oocyte. So essentially, after going through all the experimental trials in the lab, the HFEA in the UK legalized the use of cryopreserved oocytes in the year 2000. And subsequently, the USA did the same. Today, across India, we have tons of IVF clinics that offer you oocyte cryopreservation and IVF treatment using the frozen thawed oocytes or the eggs. So, who can avail of egg or oocyte freezing or cryopreservation? The first one is social egg freezing, which has become terribly common. I get at least 2 inquiries per week for social egg freezing. The second is pre-cancer therapy egg freezing. And finally, there is freezing of donor eggs. So, what is the need and why is there a trend for social egg freezing today? The reason is that career has become a priority for majority of the women, and therefore childbearing must take a backseat. There are financial concerns as well. As we all know, bringing up a child today is a terribly expensive proposition, and you need to have your finances right before you plan for a baby and the upbringing of this baby. A lot of people today are not sure if they have met the right person who can help them procreate the next generation. And therefore, finding the right partner also takes time. Then we see cases where the couple come forward for IVF treatment, but they are unsure of the status of their relationship. There may be differences. And they would prefer not to have the surplus embryos frozen because, say, tomorrow they separate, the divorce. Then begins not only the legal battle for various things like property, car, this, that, but also the legal ownership battle over embryos. Whose embryos are these? And therefore, couples might prefer to have the surplus oocytes frozen, unfertilized, to avoid all the legal hassles. Let's look at what's the story with the egg. Now, it's important to understand that when a girl is a fetus in her mother's womb, she has about 7 million eggs. At birth, these egg numbers have dropped down to 2 million, which means there is a rapid destruction of the number of eggs that are there in the reserve bank. When a girl starts her reproductive career, which is at menarche, there are between 40 and 50,000 eggs. Each month the girl gets a period. A fixed number of eggs are allocated to grow through the cycle, just like parents give their kids pocket money. And only one lucky egg becomes mature and is thrown out at the time of ovulation to hopefully fertilize and create an embryo, which means that the egg numbers are coming down, down, and down with every passing day. There isn't a factory that manufactures new eggs all the time. All you get is that there is an outgoing from the reserve bank in your ovaries. There is no incoming. So, therefore, we have this magic number 35. You must have heard everyone say to you, get pregnant before 35, have a baby. What is it about 35? Well, as I said to you, your egg numbers come down by the time you are 35 because you have been releasing eggs into the pool from the age of 10, 11, or 12 whenever you started your periods or menarche. At 35, you are trying to awaken these eggs that have been dormant within you for 35 plus years because you need to count the 9 months you were a fetus. The egg numbers after 35, not only are they low, but the quality is also poor. It's just like our skin. It doesn't look as brilliant, taut, and glow as it did when we were around 20. The chances of a successful pregnancy outcome also start declining the older you are. There is increase in the risk of chromosomal abnormalities in the baby that is conceived, and therefore the risk of miscarriage also goes up. Not to forget the maternal complications that are encountered during pregnancy and labor in women who are more than 35 because they have hypertension, diabetes, and what have you. So, freezing of the oocytes when a girl is young is like a future investment. We invest into fixed deposits, we invest into mutual funds, this, that, and everything. So if you invest in freezing your oocytes when you are young, you have the confidence, you know that you have a contingency plan available to you should you wish to delay having a baby. Because one thing is for sure that your eggs would be much younger when you plan a baby, and therefore the chances of a successful pregnancy go up. That does not mean that you can't try on your own. Say you get married at 37, 38, and you frozen eggs when you were 30. Of course you can try. But say all your attempts are unsuccessful, you can always cash in on the oocytes or eggs that have been frozen for you at an age when you were much younger. The young eggs survive the freeze-thaw process much better, and the pregnancy outcomes are absolutely comparable to those eggs obtained through a fresh IVF cycle. Now, cancer is on the rise, and today there is a ray of hope for all the patients going through cancer therapy. Prior to commencing any adjuvant therapy like chemotherapy or radiotherapy that can damage the germ cells, like the eggs in the sperm, patients can always be referred to the fertility clinic to have their eggs frozen once again as a backup plan. But the important thing is there needs to be time available to take the girl through a rapid fire IVF cycle. Of course, there are many protocols, but you still need time to give a little bit of stimulation and collect the eggs. And of course, the girl needs to be fit enough to go through something in parallel, apart from having the stress of worrying that I have cancer and I need treatment for that. I may not survive the disease process. But this backup plan is useful when there is time. So, therefore, if anybody has cancer and there is time available to push the adjuvant therapy, please do see a fertility specialist to have your fertility cryopreserved. Apart from gametes, we can also freeze the ovarian tissue. And this is done by laparoscopy, where we remove the ovary or a part of the ovarian tissue, and this can be cryopreserved with view to transplanting it back into the body at a later date. And of course, then go through the stimulation process, have the eggs collected, or one may even ovulate on their own and try naturally. A lot of women need donor eggs today. It may be that you have gone for fertility treatment very late. Your egg reserve is very poor, which is indicated with a very low AMH hormone value. The quality of the eggs is very poor if you've already gone through an IVF cycle and your fertility specialist explains this to you. You've gone at an advanced stage with no backup. You have endometriosis and the quality of the oocytes is poor. You've had multiple surgeries for endometriosis. You will need donor eggs. There are those girls who have premature ovarian failure, where their ovaries pack up, have no eggs at a very young age of less than 40. There are those that have undergone surgery on their ovaries for maybe cysts or other reasons. Those that have had radiotherapy without having prior cryopreservation. Girls who suffer from autoimmune conditions and those that might be carriers of certain genetic mutations. All of these women can avail of fertility treatment with the help of donor eggs. Now, you could have a donor selected for you, tailor-made to your requirements, or you could access the pool of donor oocytes as are available in donor banks. Today, under the ART law, a woman asking for donor oocytes can avail of up to 7 donor embryos. So, how does one obtain eggs for freezing? Of course, you need to go through stimulation to make the eggs grow in the pool that has been recruited for you in that particular month. This will involve taking some tablets or injections for between 10 to 12 days. Then the egg collection procedure, which is performed under a very short anesthetic and of course done with the help of an ultrasound scan through the vagina without giving you a cut on your tummy. Once these eggs have been obtained, we then proceed to cryopreservation of these eggs. As I mentioned earlier, the eggs need to have a cryoprotective substance added to it. And in an ultra-fast procedure, these oocytes are frozen as seen here in the cryotops. From 37 degrees, we then have to freeze these eggs in a liquid nitrogen container and bring the temperatures down and put them to sleep at minus 196 degrees Celsius. This is what the frozen thawed oocyte looks like, and what we are doing here is this is the sperm in the needle, and we're going to inject this needle inside this egg so that the sperm inside the egg, so that the sperm is in the right place to do the job of fertilization within the oocyte. And this is what the fertilized egg looks like. So there is two pronuclei, one from the sperm, one from the egg. So that's about egg freezing, thawing, and taking these eggs through an IVF cycle and then transferring these embryos into the person at the right time to help them have a baby. Now let's look at the sperm. When do we need to freeze the sperm? Now, as mentioned earlier, even men can have cancer, and it's extremely common to have sperm frozen prior to cancer surgery or prior to adjuvant therapy before chemo or radiotherapy. Those men that are magnanimous enough to undergo a sterilization procedure for family planning purposes in the form of a vasectomy can have a couple of sperm samples frozen just as a contingency plan should they need to use it in the future. The most common sperm freezing procedures are done when a couple is going through fertility treatment. Now, it is not uncommon to find during an IUI cycle or an IVF cycle that the day we need the sperm, say the day the lady is going to ovulate, or the day we need to collect eggs and we need the semen sample, men become extremely anxious and there is an inability to perform and give the semen sample on the day. And it is in these circumstances that we always procure a backup semen sample so that we don't give these panic attacks to the men. Also, if the husband is working away or the partner is working away or is flying off for job commitment, then they can back up their semen samples so that the wife or the partner's fertility treatment doesn't come to a standstill. There are men that have ejaculatory dysfunction, and these men as well can avail of sperm freezing done much before the actual fertility procedure commences on their partner. In men that have very poor sperm parameters, like the sperm count is low, the motility is poor, and there are many, many abnormal sperm in their semen sample, we not only initiate medical therapy for these men, but also encourage them to come for multi ejaculate sperm freeze, which means they can have sperm frozen at weekly intervals over 4 to 5 times, and then the pooled sperm sample is used for the fertility treatment. There are men that are born with congenital abnormalities, like the connecting tube, that is the vas deferens, may be absent. Or there may be people who may have very, very little sperm in their testes, and we do a surgical sperm retrieval for these men, and the sperm can be frozen much before commencing their partner's treatment cycle. Of course, we are grateful to the sperm donors, the young men who come forward to donate sperm and help in cases where there is a very strong male infertility factor or there are chromosomal abnormalities in the male partner. And we avail of the donor sperm samples either via IUI or IVF, ICSI. And of course, there are transsexuals who also like to have their sperm frozen. So once again, similar procedure for sperm freezing, semen sample, of course, washed, prepped, and then mixed with cryoprotectants, frozen. And the defrosted sample can then be used through IUI or IVF. So, what are the chances of pregnancy once we have frozen the gametes, the eggs, or the sperm? And that is the logical question. Now, everything depends upon the quality of the gametes that have been frozen. Of course, if it is a very suboptimal quality oocyte or sperm, the defrosted sample ain't going to be that brilliant, and therefore that will compromise the realistic chance of having a viable pregnancy. The second consideration is that what is the technique that has been used by the center for freezing and defrosting the gametes? What is the type of cryoprotective agent that has been used? And finally, is the fertility center equipped to carry out all of these procedures to the required standards? Now, if all the boxes have been ticked and if everything goes well, pregnancy rates are comparable between the fresh and frozen samples of gametes. Now, what are the prerequisites before you step into the world of cryopreservation? For fit and healthy people who are coming forward for social cryofreezing, the tests that are mandatory are CBC, the thyroid function tests, your blood sugars, viral serology in the form of hepatitis B, hepatitis C, HIV, syphilis testing, and of course, in a girl, it would be AMH, FSH, LH, estradiol. In the guy, it will be testosterone, FSH, LH, and what have you. What is also important is that prior to commencing any fertility therapy, you must refrain from smoking, quit alcohol, and substance abuse. A healthy diet with lots of fresh fruits, veggies, and salads is mandatory. Adequate water intake is also important, especially if you are going to embark on a journey of hormonal therapy. Regular exercise for between 45 to 60 minutes. And taking supplements, which may be things like folic acid, vitamin C, etc., as advised by your doctor. If you're coming forward to freeze your sperm sample, please check with the doctor the number of days of abstinence that you need prior to giving your sperm sample. Prolonged abstinence period is not ideal, and too short an abstinence period is also not ideal. Therefore, ideal times are between 3 and 5 days. Now, all of this is wonderful, but cryopreservation and ART procedures cost money. They are expensive unless it's being funded under some government scheme. So, first and foremost is ascertain the cost implications of the entire ART cycle, the surgical processes involved, including in the men, and the freezing charges. Now, some centers may charge you on a 6 monthly basis, and others may charge you on an annual basis. What is also important is that you have given the appropriate consents for freezing your gametes or embryos. Now, technically, you are under obligation to get your consents re signed every single year. Unless we have a valid consent, and if you need to pay, you should have paid. Unless all of this is done, centers will not keep your samples frozen. So just because you paid once for gamete cryopreservation, don't be under the assumption that 4 years later, when you wake up and go there, your sample will still be there. And it's not just to do with money, but when the hospitals or centers get audited, they are under obligation to show that they have the most up-to-date consents. For samples that do not have consents, those samples will be discarded. Therefore, make sure that you know when you need to go back to revalidate your consent forms, and make sure that you have paid the appropriate freezing charges, be it on a 6 monthly or annual basis. That's me with my all girls team at Fortis Hospital. This is Team Creation. We would be very happy to take any questions from you. And I'd like to thank you for a very patient hearing today. Of course, I haven't touched upon embryo cryopreservation, but I thought this was enough information to get started. And of course, we can do another session on embryos. Thank you very much. I'm happy to receive questions now. There are no questions? Okay. Thank you very much for a very patient hearing. And we hope to see you again in another live session of information, knowledge, and learning. Thank you very much.